Time now at 7:29. There are free services in San Diego to help people overcome mental health issues.
Yeah, this is important information here. Here with us now, Lindsay Kramer, marriage and family therapist with Sharp Mesa Vista. Good morning, Lindsay.
Good morning.
Thanks for being here.
Thank you for having me.
You know, my wife used to work for Sharp, so she was at Mesa Vista a lot.
Wonderful.
We know the hard work and the difficult work you guys do over there. Tell
Yes,
us about,
thank you.
on the news, the recent suicides of Kate Spade, Anthony Bourdain. Have you guys started new conversations as a result of that?
We have ongoing conversations about that. So that, unfortunately, is an issue that continues to come up that we need to continue to discuss and identify how we can further help our population. Yes.
So you're talking about mental health issues along with alcohol and drug dependency.
Yes.
Lindsay, I can't tell you how many times I've heard this conversation over the past few weeks. People shocked, they don't understand. They're so happy, they have everything.
Right.
But there are such deep underlying problems that you cannot, identify. Just the normal person to be able to say that that person is gonna do this.
Right, and it's very difficult sometimes to be able to identify those warning signs. Once you have a better understanding of what those warning signs can look like, then we have an ability to be able to connect with people and to understand what's going on for them so that we can give them resources for help.
What do you guys mean by dual diagnoses, and does one cause the other, or how does that work?
So dual diagnosis is when a person has both a mental disorder and a substance use disorder. So they'll have anxiety, and then they'll be using cannabis to be able to manage their anxiety.
Does that happen often, though? If you have one, the other will come about?
So they're not directly linked, meaning that if a person has depression, that they're going to be an alcoholic, but there's such a strong correlation. In fact, those that have a mental health disorder are 2 times more susceptible to actually having a substance use disorder.
It's almost like one thing, and you end up in this vicious cycle that's very difficult to break.
Exactly.
Is it common, this this dual diagnosis?
It's very common.
Yeah.
In my professional experience, it's quite common. Statistically, I think it's really underreported. And I think it's because we see one versus the other and not both. And so that's where mental health overall is gearing towards. I've been a dual diagnosis clinician for about a decade, so this is bread and butter to me, but for everybody else in the mental health world, I think we need to continue to combine both forces.
You say you've been doing this for a decade. Could you share some symptoms, some signs? Let's say somebody's watching right now and they're concerned about somebody they may know. How would you know that they're struggling with both?
Well, just like Raul said, I think it's a vicious cycle. So when one is used to be able to assist the other, there's a lot of self-medication going on. And so anytime that both mental health symptoms and a substance use disorder are impacting a person's functioning, that's where we would look at it being a problem.
But what would be like signs? Could you give us specific things?
So let's say that a person can't go to a social gathering unless they're intoxicated because they have such severe social anxiety that they can't manage themselves. We would look at something like that. When a person has already underlying mental health disorder and then they continue to use and have greater symptoms as a result of that, yet they continue to use despite the consequences, that's another warning sign.
What I've learned over the years is that some people are really, really good at hiding it.
Yes.
And they're functioning while they're suffering at the same time. Loved ones, friends, we want to help, but sometimes we don't even know.
Absolutely.
How do you deal with people who are so good at hiding it you can't even see through and you can't see these symptoms? What then?
It's a good question. I think we really need to be able to allow time, space, demonstrating that there are people there to be able to support them, whether it's professionals, their loved ones, and giving them the opportunity to be able to open up and let their guards down so that they can receive treatment.
Let's talk about these seminars that you're having. It's all about education, talking about it, learning about it. You're hosting 6 seminars at various San Diego City libraries and rec centers. Can you tell us about that?
Yes, so I'm focusing on dual diagnosis for my particular lecture. So the first one starts tomorrow night at 6 o'clock at the Ocean Air Theater, pardon me. And so I'm just focusing on bringing more light to different types of substance use disorder and the mental health that goes with it too. So I'll be focusing on certain types of diagnoses and the typically used substances that will go with that too.
I wonder with the drug use and the alcohol abuse and even the gun violence we've seen so much on the news, the focus has been so much on mental health and getting people the help they need. Have you seen an increase in people just kind of, what can we do?
I work in a mental health hospital, so I see a lot of that all the time. But I mean, I think continuing the dialogue is one thing, but really trying to open the access for resources is another. I think that's where we're missing a step. So yes, we're talking about it, but what are we doing about it?
What are we doing? And getting rid of that taboo.
Exactly.
That taboo is still a big problem.
Absolutely. So we really need to normalize this. We need to understand that addiction is a disease, that it does require comprehensive treatment. So normalizing that, as you say, and
That's why we talk about this all the time on this show, because mental health is like, if you break your arm, you go to a doctor, but if you have something that you don't feel right in your head, you hold back and you don't want to take care of yourself.
Right, and it needs to be treated just in the same way.
Yes, ma'am.
Now, I've always followed the rule, Lindsay, before we go, because I've been very open about this. Is that just like you go to the dentist to brush your teeth, and you go to the doctor to get a checkup, and you go get a heart test, you have a brain, and that brain needs taken care of either.
Absolutely.
And I have no shame to say that I have a person too. Like I go because this thing up here needs to be taken care of.
That's wonderful, Shali. That's fantastic. Absolutely.
So we'll get the information if you want to attend any of these seminars. We'll get them on our website, foxeyesandiego.com. Click the scene on tap. Lindsay, thank you for being here.
Thank you so much for having me.
Keep up the good work.
Thank you.
Okay, Miss, what's her name? Oh.